It's now been 2.5 years of the COVID-19 pandemic, and this catastrophe is nowhere near over. There is an extraordinary chasm between the reality of the pandemic and the delusional fantasy presented by world governments and the corporate media. All of their claims that the pandemic is over, that the coronavirus is endemic and no more harmful than the common cold, that people can safely take off their masks, and that you have nothing to worry about if you're vaccinated, are refuted by what all of us are experiencing. If the pandemic is over, why are millions of people being infected and thousands continuing to die and be debilitated worldwide every week? We're now at the beginning of yet another global surge of infections, which has already hit most of North America, Europe, and Australia, and large parts of Asia, Africa, and South America. It's being driven by the Omicron BA4 and BA5 subvariants. Multiple studies have shown that even if you've had a booster shot or were just infected over the winter, you have very little protection against getting infected or reinfected with BA4 or BA5. In South Africa and Portugal, which have already had waves of infections from BA4 and BA5, deaths have surged once again, reaching levels not seen since January or before. We can't predict precisely how many people will be infected or die from a given variant, but it is very likely that BA4 and BA5 will cause a substantial wave of infections and deaths throughout much of the world in the coming months. Official figures are known to vastly undercount infections and deaths, and over the past 7 months, nearly every world government has largely dismantled testing and reporting infrastructure. A more accurate picture of the reality of the pandemic can be seen by looking at excess mortality, which is an estimate of how many people would still be alive today if it weren't for the pandemic. According to The Economist, there were roughly 5.9 million excess deaths in 2020. In 2021, there were another 12 million, and in the first 6 months of this year, there have already been another 3.5 million, bringing the total to roughly 21.4 million excess deaths worldwide. The full magnitude of this tragedy finds expression not only in the level of death, but in the far greater number of people who have been infected and now suffer from long-lasting symptoms known as long COVID. The more that scientists and physicians learn about long COVID, the more terrible it is. Numerous studies show that roughly 10 to 30% of COVID patients go on to develop long COVID, which can affect nearly every organ in the body, including the lungs, heart, brain, kidneys, and more. Some of the most common symptoms are extreme fatigue, cognitive dysfunction, and chronic pain. It has been proven that COVID-19 infection leads to increased risk of damage to nearly every organ in the body, as well as to risks of developing diabetes, stroke, heart attack, a range of neurological disorders, and more. Your risk of developing long COVID builds with each reinfection, and a recent study found that being vaccinated only reduces your chance of developing long COVID by about 15%. Long COVID advocates have correctly called the pandemic a mass disabling event. Official data released by the US government this week found that an estimated 20 million American adults are currently suffering from long COVID. If this figure is extrapolated for the global population, there are likely at least 400 million adults worldwide now suffering from long COVID. It is impossible to quantify the impacts of this mass disabling event on patients' ability to function at work and enjoy leisure time. For the past 2 years, the CDC and every other national health agency in the world have been fully aware of long COVID and the enormous dangers it poses. Nevertheless, almost all of them have consciously allowed billions of people to be infected. They don't want people to wear masks because these are a daily reminder of how severe this virus is. You can't live with COVID. You can die of COVID and you can be debilitated. But COVID isn't a noisy neighbor or a grumpy uncle. It's not something that we can or should tolerate as a society. This is a virus that spreads easily. It's not pleasant to look at the world this way, but it is almost guaranteed that whenever you go to a location where there are crowds of people, especially somewhere indoors, like a grocery store, a warehouse, a factory, or an airport, you will inevitably come into close contact with individuals who, without realizing it, are infected and spreading the virus. A high-quality mask can protect you against infection, but the pandemic can only be stopped at the social level. In early 2020, China and many other countries in the Asia-Pacific region eliminated the coronavirus by implementing these basic public health measures. 1. Mass testing wherever outbreaks occur. 2. Rigorous contact tracing to identify all chains of transmission. 3. Safe isolation and treatment of all infected patients in medical facilities. 4. Quarantining of all people exposed to infected patients. 5. The temporary closure of all non-essential workplaces and switch to remote learning at all schools until the outbreak is contained. 6. The provision and mandating of masks in all public places. 7. Mass vaccination programs. And 8. Strict travel restrictions and border management to prevent the importing of new cases. If these measures were put into place on a world scale, combined with the improvement of filtration and ventilation systems in all indoor spaces, and a mass education campaign on airborne transmission, the pandemic could be ended globally in a matter of months. China is the only major country which has maintained this zero-COVID strategy because it is immensely popular in the Chinese working class. Most recently, they defeated a major surge of the Omicron BA.2 subvariant, as we see in this chart. Chinese society has proven in practice that elimination is possible, but also that it must be expanded to every other country. The fight to eliminate the coronavirus globally requires a massive social and political struggle of the international working class. Fundamentally, the fight against the pandemic and for public health is not simply a medical question, but primarily a political, social, and economic issue. Powerful corporate and financial interests are determined to prevent paid lockdowns and all other measures necessary to stop the pandemic, because this would halt their record profit-making. Since March 2020, the world's billionaires have amassed over $5 trillion. At every point, they have prioritized corporate profits over public health. A worker who is social distancing at home is not making money for the corporations. It's as simple as that. The ill-gotten gains of these pandemic profiteers must be seized and redistributed to guarantee all workers and small business people full income protection and healthcare during temporary paid lockdowns. The pandemic can be stopped, but it requires a mass movement from below, uniting the working class with principled scientists internationally. Just over 1 year ago, the International Committee of the Fourth International, which publishes the World Socialist website and produced this video, announced the formation of the International Workers' Alliance of rank-and-file committees to organize workers across industries and national boundaries. This global network of rank-and-file committees is fully independent of the trade unions and capitalist political parties which have conspired to impose the pandemic policies that have killed millions worldwide. We urge all workers, students, and professionals watching this video to fill out the form below to join or build a rank-and-file committee at your workplace or neighborhood in order to take up the fight to end the pandemic. These are the measures that need to be taken in every factory, workplace, school, and neighborhood. Discuss this with your friends, family, and coworkers. Your lives and those of your children, your parents, and your grandparents are at stake. Life is precious, but that's not the way that it's treated under capitalism. As long as profits are prioritized, people will continue to become sick, debilitated, and, in the worst case, die. The WSWS has also initiated the Global Workers' Inquest into the COVID-19 pandemic to uncover and document all the crimes that have taken place and are ongoing. We urge you to share your story with the inquest, which is gathering testimony from workers, scientists, and anti-COVID activists throughout the world. If you want to participate, fill out the second form below this video. Most importantly, read the World Socialist website every day and support our work. From the very beginning of the pandemic, we have called for the elimination of the coronavirus on a world scale. We will continue to lead this fight, which must now be deepened in each country. Thank you.